If chest pressure ever hits while you're alone, the most important decisions you make won't happen in the hospital. They'll happen in your living room. Not dramatic decisions, not complicated ones. Just a handful of specific moves in the first few minutes that can significantly influence how much of your heart recovers. Most people don't know those moves, and that lack of clarity is where time gets lost. Before paramedics arrive, before sirens even turn onto your street, there is a short, powerful window where your actions matter more than you think. The goal is not to panic. The goal is precision. Let's walk through exactly what to do. First, understand this. The early minutes of a cardiac event are not passive. When blood flow through a coronary artery is reduced or blocked, heart muscle is deprived of oxygen. The longer that deprivation continues, the greater the risk of permanent damage. Emergency teams are trained to restore blood flow as quickly as possible, but they cannot begin treatment until they reach you. That means the bridge between symptom onset and paramedic arrival belongs to you. We start with access, because if emergency crews cannot physically reach you quickly, everything else slows down. Imagine calling 911. The dispatcher confirms help is coming. Paramedics arrive at your address, but they're stopped by a locked door. Emergency response audits from major metropolitan systems show that forced entry delays can add 4 to 7 minutes before patient contact. In cardiac care, those minutes are significant. The moment you feel persistent, unexplained chest pressure, especially if it radiates to the arm, jaw, or back, or is paired with shortness of breath or nausea, unlock your front door. Better yet, open it. If you have a screen or storm door, prop it open with something sturdy. Why make this step first? Because blood pressure can drop during a cardiac event. If you become lightheaded or lose consciousness, you may not be able to answer the door. If responders must wait for forced entry, valuable treatment time is lost. Next, make your home easy to identify. Turn on your porch light. Turn on your living room and hallway lights. Make your house visually stand out from the others around it. EMS crews scan quickly, especially at night or in poor visibility. A brightly lit home can be identified faster than one in darkness. If you live in a gated community or secured building, call 911 first, then immediately contact a neighbor, concierge, or building manager to meet responders at the entrance. Removing physical barriers protects time, and protected time protects heart muscle. Now we move to chemistry, specifically aspirin. Most heart attacks begin when a plaque inside a coronary artery ruptures. The body reacts by sending platelets to the area to repair the injury. These platelets stick together and form a clot that blocks oxygen-rich blood from reaching heart tissue. The goal in the early minutes is to slow that clot formation as quickly as possible. Research from the University of Texas Southwestern Medical Center demonstrated that chewing aspirin accelerates absorption compared to swallowing it whole. A swallowed tablet must dissolve in the stomach before entering circulation, which can take 20 to 40 minutes. Heart muscle can begin sustaining irreversible damage much sooner than that. The difference between chewing and swallowing is not trivial. It is clinically meaningful. Chew 1 325 milligram non-enteric coated aspirin, or chew 4 81 milligram baby aspirins. Chew thoroughly until it becomes a paste before swallowing. It may taste bitter or chalky, but that is secondary to speed. Chewing allows faster absorption through tissues in the mouth and speeds platelet inhibition. Studies show chewed aspirin can begin working in as little as 5 minutes, substantially faster than swallowing. Unless you have a known severe allergy to aspirin, this is one of the most effective immediate actions available before EMS arrives. If you have prescribed nitroglycerin, this is where it fits in. Aspirin works on clot formation. Nitroglycerin works on the blood vessels themselves. It relaxes vascular smooth muscle, widening vessels, and reducing workload on the heart. By decreasing resistance and easing strain, it can improve blood flow and reduce discomfort. There is a strict method for using it safely. First, sit down before taking it. Nitroglycerin can lower blood pressure quickly, and standing increases the risk of fainting. Second, place one tablet or one spray under your tongue. Do not swallow it. The sublingual area allows rapid absorption directly into the bloodstream. A mild tingling sensation is common and indicates the medication is active. Third, wait 5 minutes. If discomfort continues, take a second dose. Wait another 5 minutes. If symptoms persist, take a third. Do not exceed 3 doses. Important warning: if you have taken medications such as sildenafil, tadalafil, or vardenafil within the past 24 to 48 hours, do not take nitroglycerin. The combination can cause a severe drop in blood pressure. In that case, rely on aspirin and wait for EMS. Knowing this interaction in advance prevents a dangerous complication. Now let's talk about positioning. When people feel weak or dizzy, the instinct is often to lie flat. During a cardiac event, sitting upright can reduce strain on the heart. Lying flat increases venous return, the amount of blood flowing back to the heart, which can increase workload on already stressed heart muscle. Sitting upright reduces preload and improves lung expansion, helping oxygen exchange. Use what is often called the W position. Sit on the floor rather than elevated furniture, so if you lose consciousness, you are less likely to fall. Lean your back against a wall or sturdy surface at about a 45-degree angle. Bend your knees with feet flat on the floor so your legs form a W shape. This position allows gravity to keep some blood in the lower extremities, slightly reducing cardiac strain. It also frees the diaphragm, allowing your lungs to expand more effectively. Respiratory research shows improved oxygen levels in semi-seated positions compared to lying flat during distress. Next is breathing control. Chest discomfort can trigger anxiety, which leads to rapid, shallow breathing. Hyperventilation can constrict blood vessels and increase heart workload at the exact moment efficiency matters most. Instead, engage controlled breathing to stabilize your nervous system. Inhale slowly through your nose for 4 seconds, expanding your abdomen rather than lifting your shoulders. Hold for 2 seconds. Exhale gently through pursed lips for 8 seconds. The longer exhale stimulates the vagus nerve, which helps slow heart rate and reduce the stress response. This controlled breathing can lower oxygen demand and promote cardiovascular stability while waiting for medical support. Maintaining steady breathing is not simply about comfort. It directly influences physiology. Finally, document the time symptoms began. Hospitals use clot-dissolving medications and other advanced treatments within specific treatment windows. These therapies can restore blood flow and reduce long-term damage, but clinicians must know exactly when symptoms started. If that information is unclear, treatment options may be limited. The moment symptoms begin, note the exact time. Say it out loud, write it down, send a text message to someone. That timestamp can guide hospital decisions and may determine eligibility for certain therapies. These steps do not replace emergency care. They bridge the gap until it arrives. The early minutes are not about fear. They are about focus. When you know exactly what to do, those minutes become structured instead of uncertain, and structured action, taken early, can make a measurable difference. Stay informed, stay deliberate, stay ready,